Hey everyone, before we begin, just want to let you know the two idiots now have a merch shop. So, if you want to rep the podcast, help support us, help us get new equipment, make a better show for you, head to teespring.com/stores/2-idiots-podcast. I realize that's a mouthful. That's a lot to type. So go to our social media and the links are there. So that's teespring.com/stores/2-idiots-podcast. See, it's even hard for me to say, but it's easy to find. Get yourself some t-shirts, mugs, shirts, masks, got a whole bunch of stuff. And from now until the end of January 2021, we're donating 10% of all the proceeds from the store to Southeast Helping Hands, the local food bank here in our area. So go there, help support us, but more importantly, help support them. Cheers, folks. On with the show. Hello, everyone. Welcome to another episode of the Two Idiots Podcast. I'm Reg.
I'm Randy.
And as I mentioned in a previous episode or whatever, we're trying to do a tagline to start episodes for new listeners. So basically, we're two idiots trying to figure out the world one conversation at a time. Hey, look at that.
Hey.
I don't know if that's accurate or not, but that's what we're going to say. Joining us this week is Jessica Peebles. Welcome here.
Welcome.
Hi. Thank you.
Thank you for joining us. How about introduce yourself a little bit?
Yeah, I am a healthcare aide. I also run my own staffing company. So we work privately throughout Manitoba to fill in the needs where they're short staffed. So whether it be at personal care homes or at hospitals or even in private home care. So that's kind of what we do. I have a small little team of students because I'm focusing my company on trying to support students while they go through schooling. So I've kept my company pretty small in that aspect so that I can keep the support on my staff that I already have. So we basically go around facility to facility and we fill in the needs where they need us, I guess. So
that's good.
We're the people they call when we're Batman. They have the bat signal in the sky. We gotta go
Yeah.
to that
Time
hospital.
to go. Yeah, Autobots roll out. That's great. I imagine. Oh, actually, I don't actually know. But as far as staffing goes, I assume there are a lot of shortages even before COVID in Manitoba.
Yeah, it's been something that I guess Manitoba has struggled with for a long time. Staffing agencies have been around since I remember. I guess it's not normalized to the mainstream society, but like my mom was an ER nurse. So she worked in staffing agencies her whole career. So I always knew about them. So I thought everyone knew about them. But no, a majority of the staff who are in healthcare are women and they have babies. So they go on maternity leave. They need people to come in to cover those shifts. People call in sick. They may not have people to cover. So they call in private people like us who are all trained and we're all licensed. And we just go and we fill in the needs. So that's what a staffing company basically is. There's a few of us. There's a handful of us that are around. So yeah, they all cater differently to their staff based on how they want to run their company. So
cool. I'm glad that.
Yeah, I certainly didn't know. I just kind of assumed that every hospital had nurses, and if they had someone had to come in like on an off day, they'd come in, right? So
yeah, they definitely try to do that first. But in a lot of the places like that are rural, the population might be a lot smaller. So how many people want to be nurses when they grow up, right? They might not even actually have enough nurses living in the area to staff that facility, right? So they rely on agencies to come in to fill the need where they need.
Yeah,
for sure.
Especially in remote communities, in Manitoba in particular, because that's where we are. It's not uncommon to be, hours away from probably the nearest healthcare facility, I would imagine. Mm-hmm. So.
Yeah, that's exactly it. And if those places aren't staffed, then where are those people going to go if that's their only access to healthcare? And if it's not staffed, then that's not good. So
Yeah.
that's why we exist.
Yeah. And that, again, I'm glad that that is a thing, because I feel like there's always the southern province bias, right? Or the Winnipeg bubble, where it's everybody within Winnipeg, they have their own issues around Winnipeg, and they don't really think about past the perimeter a lot of the time. And, you know, all the big cities, all three of them, I guess, whatever Manitoba has, it's very common to not even think about the communities that frankly might not even be that far away, but far enough that they're like, I don't know, who cares? They'll figure it out. So I'm glad you're there to fill the gap.
Yeah, that's actually exactly it. That's what it seems like. It just seems like it's like, all right, you're on your little island over there, so figure it out. Here's your budget. So they try their best to do what they can in the circumstances that they have, right? So
sure, and it's
very true.
It's difficult, but I am, I commend you and people like you and other companies as well that are trying to do that to fill the gap that clearly exists. So thank you.
Yeah, welcome.
So on to what we were going to talk about. So basically, by the time people will be listening to this, hopefully they've listened to our COVID episode and other commentary on other platforms about people being impacted and hospitals and personal care homes and everything across the province being slammed and frankly in many ways not supported likely like they should. But you, Jess, have more personal experience of care homes in general. So maybe, because you reached out to us, so maybe tell us why you want to talk to us.
Yeah. I actually wanted to bring forward a couple of things because you guys have a growing audience, and I'm sure a lot of people are wanting to learn more things, right? That's why they tune into podcasts. That's why I do anyway. But I just feel as though the general public doesn't really understand what goes on in care homes and how we aren't able to do things like social distance properly because we need to be touching the person, talking to them face to face. And there's no chance for social distancing whatsoever, which is the number one way to keep yourself safe, right? Besides masks, right? There's a whole bunch of tools in your toolkit. You can wash your hands, wear a mask, and social distance. It's because it's through respiratory droplets, right? So a lot of these facilities that you go to, they might not have been made specifically to be care homes. So the ventilation may be poor. There may be a bunch of other things like not access to a window that opens properly and fully, like it maybe only opens from the top. So ventilation is very poor. So we're going in as healthcare workers from room to room, breathing on people because we have to roll them to move them to get them into wheelchairs. Some people are hearing impaired, so we have to yell at them so that they hear. And if we're only wearing surgical masks, then that's coming out, the air propellant is coming out from the side when we're yelling at them to tell them what we're doing. And they don't have the same rights as we do in the sense that we can say, hey, get out of my bubble. They don't have that. They have to rely on people to live their day-to-day life, right? So that's why it's so important to keep the community levels down so that it keeps our exposure to the virus down so that we don't bring it into work. Because it takes 4 to 6 days or something for you to actually get symptoms. So you could be walking around for 4 to 6 days, and with the staffing levels that it is right now, they're doing 16-hour shifts. So they're going person to person to person, unit to unit, 16-hour shifts, breathing on people, and in the poor ventilation. So like that's why it needs to stay out of personal care homes, because once it gets in, it's very hard to contain because there's just so many factors that the general public just doesn't see.
That's
and hearing it that way makes sense, because it sounds like everyone's like, well, how did I get into these care homes, right? Like if people are being safe. And I think what people don't realize too is that like they can't expect people who work in these homes to just go home and not want to have a little bit of a life even in these times, right? So we all have to kind of do our thing to keep you guys safe, to keep them safe, And just hearing that, right, inadequate ventilation, not the proper masking because of PPE shortages, like that's a lot more than I think a lot of people thought going into it, why it's spreading like it is there.
Yeah, and also too, like there's equipment shortages. Like let's say that I'll just use just a stereotypical 20-person care home. Okay, there are 2 lifts that you use because people can't get out of bed. They have to use 2 different types of lifts. So if multiple people use those lifts are going from person to person to person. And before the outbreaks happened, we weren't wiping them down person to person because it's just not enough time, even though we would only wipe down if it was like visibly soiled. But now with the staffing shortages and with the extra precautions, it is now taking staff so much longer to do their jobs because we have to get gowned up. We have to make sure everything's disinfected in between uses of everybody. So not only are regular staff already pushed to the limits in terms of like, they're on your feet for like, we walk like 15 kilometers a shift. So it's nuts. And they're doing it day after day after day. Eventually you're going to get tired and you're not going to follow proper procedure. It's just human nature. You just get exhausted, and that's how it gets in. And it's not no one's fault. It's just how the system is right now because it's so burdened.
Well, yeah. And we're all, I mean, everybody's, I think, on the verge of burnout, and we're not even working in healthcare like Randy and I, but like it's to think that that's like every single day, you know, or multiple days a week, working that long, that hard in close contact with people that may be positive or are vulnerable. And frankly, you know, I think it's been pretty well documented that at least in Manitoba, our personal care homes have been underfunded and undersupported for decades under several different governments. And it's no different now. But now when COVID hits, suddenly everybody's at home. Like, we all know what a care home is in theory. I don't have any grandparents in them, but we all know someone that does. But again, we don't really know. You know, it's one of those things that just exists, but if you're not in it, you really don't spend any time thinking about it. So now that we are, we're realizing just how awful that situation is.
Yeah, and I just wanted to bring light to like a lot of the people saying how lockdown is infringing on their rights and everything. And I understand 100%. However, people in personal care homes have been under lockdown since March. Wow. And we can't respect them enough to stay in our homes for 2 weeks when they've been locked in their rooms, confined to being alone, to only speaking to their family through windows or a tablet. And we can't literally sit home for 2 weeks with Netflix, with delivery food services. Like, we can't. Sometimes it just blows my mind that there are still people out there who just think so selfishly. And that's what it is. I think just they're not seeing how their actions actually can affect people's lives.
Of course.
And I don't know.
Freedom over fear.
Yeah, this is literally the easiest time to be called to do your job and sit at home.
Yeah, right? We have like every single means necessary to do this right now. So like people are still finding ways to complain. So I don't know. But I just put myself in their shoes. Like, they literally can't leave their rooms. Like, some of the rooms are 8x8, 10x10. Some people have made comments about saying how they feel like they're in prison.
Yeah.
And it shouldn't feel like that. And it's just because of the precautions, and we try to explain to them all the time, saying it's actually to keep you safe. And they don't care at this point. They just want to see humans.
Yeah.
Like, so that's all. And
Which is sad too, because you know, if the roles are reversed and it was, you know, young people and people our age dying at a rapid rate, that they would be doing everything they can to keep us safe. But I mean, here we are, right?
Yeah. And I feel the same way too. So I just feel like it's just lack of experience, and just like they just don't understand. That's all. And you don't really know until you know. So
yeah, but it's frankly it's so common with so many different issues where people say, you know, I don't get it. It's like, you know, I know a lot of people back in the day, particularly involving like homosexuality or things like that, or even indigenous issues. People are like, I don't get it, but they never make any effort to get it. It's easy to just say, I don't get it, I don't like it, it doesn't make any sense. But if you're not trying to make it make sense, then it's your fault.
Yeah, and I think there's a term for that. I can't remember off the top of my head, but it's like cognitive dissonance or something, where something sits with you and resonates so, like, it just doesn't sit with anything that you've learned in your entire life. So you're just like, nope, can't be true.
Yeah.
So,
yeah, basically, I always understand it as, you're carrying two different ideas in your brain, which don't necessarily go together.
Yeah, that's what it is. And then I can't remember exactly the terminology for it, but like it just doesn't compute.
Yeah. I don't know.
You don't know how to handle it.
I would think that by now, people are starting to get it a little, because again, as we mentioned in previous episodes, we all know people that have had family members die from COVID, and you'd think that it would start to permeate. Maybe it is, but I don't know. It's also another thing of, when they first started, everybody kept saying, it's mostly affecting old people, as though that somehow made it better, and that we don't have to worry about it as much because it's just the old people, right? It's like, but those old people are, family, they're veterans, they're people, they're alive, they have families too, and just because they're older than us, why should we just think that they're expendable and we shouldn't worry about it?
Yeah, and it's so hard too when all the the deaths come out every day they put them out, and it's numbers, right? It's a 70-year-old male from blah blah blah, it's an 80-year-old female from here. It's hard to, if you can't put a face to it, and I know you can't do the names for privacy reasons and stuff, but like I said, if you could say like James Reimer, 80 years old, passed away today from this, I think that would help it hit home for more people, because that could be a dad, a grandpa, it could be your uncle, auntie, whatever, right?
Yeah, I agree.
Yeah, exactly. And doing the agency work, it's actually been something that's been really enlightening in that sense, where I would go to facility, room to room, and I would get to see a snapshot of these person's lives. Like their photo albums are there to sit and look through with them. They talk about their stories. So like when you actually are working and you see them and you get to know them as human beings, and how they fought in the war, or how they raised 9 children and 2 of them are doctors. And, these are people who actually contributed to society still. Like, we're forgetting, oh, they're old, they don't matter. No, they built everything that you have right now. And we just need to respect the fact that, they have ailments right now that make them susceptible to having severe complications to COVID. And we need to protect them and respect them, because they may have made their mistakes in the past. They didn't have all the knowledge that we have these days, right? So I'm not enabling their behavior. However, things were a lot different back then, and they did what they could. So, I mean, a lot of people are like, well, my parents, they didn't treat me properly and everything. And I get it. However, it's not just your parents are sitting there in the care home. There are other people's loved ones who are wonderful, like, human beings. And I don't know. I guess people just really don't see it as them being people. That's right. Because people, they're just numbers and statistics every day that Dr. Brent Rusin is like spewing, right? So that's all it feels like, but it's real people when you're actually in it. And I've worked at some of the outbreak facilities, and some of those numbers that he's calling are the people that I was holding their hands while they're dying, because their family weren't allowed to come into the outbreak facilities. So it's different when you're looking at it from that sense. That's all. And not a lot of people see it like that.
How is it being someone in it, dealing with it in different facilities across the province, dealing with different issues and different people? How is it hearing the public messaging coming from whether the government or from healthcare professionals, etc.? How is that for you to hear how they're talking about it?
Well, for me personally, I guess I'm in a very unique position because I work privately and I'm also an employer. So when these facilities call my company to say, we really need staff, they're not calling for nurses. They're calling for healthcare aides, because healthcare aides, we're in such close contact that we're the ones who are getting sick too. So when they're announcing the numbers for all the healthcare professionals, like and they break it down, paramedics, nurses, and they say staffing support, that big chunk of staffing support, a majority of them are healthcare aides. So we are the ones that I just feel like, yeah, they're pushing all of the rules and the guidelines for the communities. However, they're not putting the protections in place for us personally to go to work, especially working privately. There were times where I went to some of the facilities and they didn't have proper masks. And then they were asking my staff and me to go into a COVID positive room without an N95 mask. And I was like, no, I'm sorry. I still have the right to refuse unsafe work like you guys. Just because we are private contractors doesn't mean you can just come and shove us into the rooms. And then if you think about it, we're going from place to place. So you want to try to keep us away from COVID positive residents because we're the ones going from, not that we're not afraid to do it. We're in outbreak facilities right now. But it's just, when I think about it, it doesn't make sense. Like, I feel like the way things are right now is very chaotic. And I just don't feel like the government themselves planned enough for the second wave. And it hit us too hard. So not only were they already dealing with the staffing issues regardless, right? But now people are having to be forced to go home to wait for their test results, so they can't go to their shifts. So now extra people are working doubles, and you can only work a double shift and they can't make you stay any longer.
Right.
So if they don't have anybody, then there's nobody. And with the issue with the media stepping in and trying to push the agenda for nonprofit care, I'm totally behind. I don't like for-profit care and care homes. I don't think that it should be there. However, the push from the media made it so hard to staff those facilities because people were terrified to go in. We couldn't find people to go into these facilities. So people were dying because we couldn't find people to go in. And it had nothing to do with neglect and negligence in that sense. There was not enough people because people were afraid to go to those facilities.
So on that point, you're saying there's not-for-profit care homes and then for-profit ones? Is that what that means? Yeah. So there are ones that are run by the government, and there are ones that are private for-profit care homes. So depending on what your budget is for what you can afford monthly, that's where you go for care, right? And certain facilities cost more, so they have more amenities for to keep people safe. They have bigger spaces. They have, and depending on your wage or how much you can afford, this isn't the case for all, but I mean, it is the case, unfortunately. But it costs money to be in these care homes. Yeah. So if you don't have money, then you're going to go to a care home that you get put into a double room or something, and there's not adequate spacing because no one's planning for a pandemic in times like this right now, because we are struggling to find placements for our senior population. There are people waiting placements in hospitals right now for beds in personal care homes because there are no places for them to go. And that's where the bigger issue is, right? And it's like there's not enough places that are adequately ventilated, but that are supposed to be care homes that are care homes right now, if that makes sense. Yeah, it does.
Great.
Because some places were like old apartment buildings, they weren't designed to be care homes. So that's why some of the places are hit harder than others, because they just, the design flaws, there's so many different factors, right? And it depends on how many people are in the facility who wander around, right? They walk around from place to place. Then we're not there to hold their hands because we're in a room with somebody else to keep them away from COVID positive people. Then there's, it's just, there's so many factors that I think just the general population just doesn't actually consider when it comes to that. So with the whole government not supplying proper masks, that was huge because we are in close contact. And I just didn't understand. And I even asked, I said, can my staff personally, can I mask my staff with the same mask that the paramedics wear? And I will pay for everything and they will take care of it. And we weren't allowed to do that because it wasn't in the rules. So the paramedics are allowed to do that. But us as private contractors, we have to go in and rely on whatever's in that facility. So if they don't have proper masks, I just tell my staff, don't do it then.
How does that make sense? That's
ridiculous.
ridiculous.
That seems very strange. Yeah.
Why wouldn't you want, if me, Tom T, taxpayer or whatever, wants to spend more on something, then frankly the government should be like, thank you. Yeah, please do. Have at her. Do whatever you like. How could what?
I just like, and I brought that up in a meeting actually, and I said, I was like, can I staff my people, or can I equip my people, my staff, with the same respirators that the paramedics use? And then they said that I couldn't because the paramedics get a different company or something that cleans those masks for them, but so we couldn't bring our own in. But I said, but can my staff clean the masks in front of your staff after every shift, and I'll pay them to stay there and clean it? No. Then they were like, we'll get back to you, but no one ever got back to me. So like, when like I said, look, we're not afraid to go in to help people because we have the skills to be able to do it, and we're trained, right? And I feel as though like if it were a war and I was a soldier, then I would be going on the front lines too, because that's what I signed up for, right? But I mean, I understand people have their own families to protect and stuff, but I just like I said, the proper protection isn't there, and I feel as though a lot of the government employees, the people who are actually employees of the hospital, aren't able to say those type of things because they might lose their job, right? Yeah. And as private contractors, like I said, like we don't mind coming in to help. However, the equipment needs to be there. Mm-hmm. And if it's not there, then we should be allowed to bring it in ourselves to protect ourselves and our family.
You would think.
100%. Yeah. Do you think at this point, I mean, I don't know what the outbreak situations are like right now. I haven't checked recently. But, you know, like they did in Ottawa, a lot of the care homes, and in Quebec and Ontario, do you think bringing in the military to help out with some of these homes would be beneficial, and perhaps to do a overall report like they were doing over in Quebec and saying, these are the conditions, this is what's happening, as kind of like an outside force coming in to do the checklist and be like, hey, this is the shit you got to fix and you got to do it now kind of thing?
Yeah. If it gets to that point, I honestly do think that it needs to have an outside unbiased source come in, because I have personally went to places and I am an unbiased source that comes in. And there have been times where because somebody's aggressive and they have dementia and they're a big person or something, they may fight when you're trying to help them get washed up, right? Mm-hmm. So, as a healthcare worker, you have the right to refuse unsafe work. So if that person's punching you, then you have the right to not give them a bath, or you have the right to not, but how many weeks does that have to go on for, somebody has to step in and be like, okay, the care needs to be done on this person. And I understand that he's being aggressive, but he still needs a bath. And I remember walking into one facility and I looked through the paperwork and I was like, he hasn't had a bath since September.
Oh, wow.
And it was January.
Wow.
So, and then when I bring that up and I was like, I understand. However, you should be putting some type of, something on paper so that you can get some kind of medication to calm him down so that we can give him proper care and take care of him.
Yeah.
And then so immediately right away it was in that book. But then I brought up other things, and then that care home politely asked to not have my company back because I was bringing up all these issues
right.
that they were just trying to sweep under the rug. So, so then I would have to tell my staff, well, we're not going back there. And, but it would make me really sad because like the regular employees would be telling me like, yeah, we've been trying to advocate for a long time and they just don't have the power because the money isn't there in the government funding to be able to supply certain things, to give us certain supplies, even before the pandemic. So the government was making cuts before. I would go to facility, and every facility was handling the cuts differently. So one facility would maybe change the brand of soap, or one facility would maybe change, remove this type of brief or something. They would change something. So it when the government cuts happen, it eventually falls down to the level of us and the care being provided, because that's what's inevitably affected. So I don't know. Yeah.
Speaking of,
I just rambled about that.
No,
sorry.
that's great. That's
all good.
podcasting. That's all we do is
I'm
ramble.
passionate about it because it just bugs me.
Yeah, I get
I
you.
don't understand why money has to be a thing when there are people literally. People.
Well, it's
people
because
matter more.
it's because we have conservatives running the show. That's why.
Yeah. Capitalism.
Yeah, no kidding. It's all about the bottom line and the dollar and cutting costs, and yet cutting services and never talked about. Speaking of which, a lot of people talk about, or a lot of people that are trying to not deny, but kind of downplay the impact of COVID. They like to say that no more people are dying or this year than any other year, or the impacts on hospitals are exactly the same. The ICU is always just as full, blah, 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 blah. In your experience, would you say there's any truth to that? Are you guys, it sounds like you're more slammed than you were, but are we wrong? Are they right? I don't know.
I'll just say this, that there was a weekend, in a week span, I think I got a call from 7 different personal care homes, desperate for staff, like literally begging me, saying, we'll do anything, like we need anybody. And those are care homes that I personally reached out to years ago to be like, hey, I have a new company. This is my company. And they all said no, because they don't rely on agency staff. So when facilities are calling agency staff to come in when they never relied on them to begin with, I think that there is an issue and that we are overburdened, because where are the staff coming from? Like, people don't understand, like, we can run skeleton crews. However, it's emotionally taxing on the workers. It's physically taxing on us. It's also the same for the patients and the residents, because now there's not enough people. If someone needs to use the bathroom, they have to wait a half an hour so that someone can come and help them go to the bathroom, because there's not enough staff. And so I don't think that that's right, so, and some people can't physically hold it for a half an hour, and there definitely isn't enough, staff. So and I brought that issue forward to the government, saying, like, you need to do something, like there needs to be something done. And I brought forward, like, as I said, as a healthcare aide, like, this is what I need, this. They don't even need to be trained healthcare aides. All they need is just to be able to help me do certain things so that I need a partner for, right? Mm-hmm. And then they released that program with Red River College. So hallelujah, they listened to me. So they're fast training a bunch of people who can be that support for the healthcare aides who are doing 16-hour shifts and working alone when we shouldn't be working alone, so that we have that extra person there to make the clients feel safe. And that's what it is, because I'm listening to the clients and the residents, and they're the ones who are telling me that they're scared. Every day somebody comes in, it's somebody different. They don't know. They have to every day explain, oh, you have to do this, you have to do that. That's not living for them. We need to get this under control in terms of how it's spreading in the community, so that we can keep the care home safe with the staff that they are familiar with and comfortable with, rather than having a bunch of strangers come in and just rushing to try to get everybody done, because we don't have 8 people to take care of anymore. We have 15 or 20, so like we're running around like crazy, and things are, and I just don't want it to happen to other care homes. So I want people to understand that it's actually an issue. Like, it really is. And people are unable to talk about it because they could lose their jobs. And I'm afraid, am I going to lose my contract with the government? But I don't know. I feel as though this has been something that's been pre-pandemic, so it needs to be addressed.
If it's any consolation, nobody important listens to this. You'll be okay. It's fine.
That sounds great.
Yeah. Well, on some level maybe, but
I'm
no,
sure
I totally
can
get
find
that.
other things to do.
Yeah.
But I really it bugged me so much that I really needed to just say something and bring it forward to the government and be like, okay, that's enough is enough. Because how many times am I going to send my staff to work places that are short staffed themselves? So like,
Yeah.
that's all.
It's like sending a regiment of troops out into the battlefield with no bulletproof vests, no ammunition, no nothing, right? You can't expect anything to get done if you don't have the proper stuff for it.
Yeah, and we're not even allowed to bring it. So
Yeah.
That's the one thing that bothers me, is that like and when I send my staff to places, like literally this whole past couple months, I don't sleep properly because I'm terrified that one of my staff members is going to get it, going to get sick, and I'm going to feel so guilty because I'm their boss and I sent them there, you know, and that's why I'm right there beside them, like being like, I'm not just sending you here on your own. Like, I'm here with you. Let's do this. Let's help take care of people. And that's, so I just wanted to, can I just say, like, also too, like, I'm so proud of my staff. If my staff
Absolutely.
are listening or ever see this or listen or anything, I'm so proud of you. You are all incredibly so brave, and you really make a difference in those people's lives. So I just want to say thank you so much for everything that you do.
Shout out to them. Holla.
Yeah.
Keep it up. Keep it up. Whoop, 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 whoop.
Yeah. So
no, that's amazing.
it definitely is a huge issue in care homes. So I know that I ramble. I get so passionate about it, and it's just been something that I've seen for years. So it's just been amplified in the last month or so because of the issues, right?
There's no shame in
I mean,
that.
we say it all the time, right? Like, you have to have someone brave enough to talk about it, or else it's just not going to get out there, and then people won't know, and it's just going to keep getting worse and worse.
Mm-hmm.
Yeah, and that's what I want it. I don't want to come at it and be like malicious and be like, oh, the government's like whatever. But no, like, you actually, they just need to see that this is actually a priority. And when these cuts are happening, these cuts may just look like numbers on paper to them, but in the real world, it's affecting people's lives. So
Absolutely.
I wish that they can see it a little bit more. I wish that some of these politicians could come in right with us and help us feed people and help us, you know, like, but they're not. They're not actually seeing it. They're advocating on that level to the media for the public, but they're just advocating for everybody, right? I just feel as though not many people actually see what it's like. So,
but come on, Brian Pallister was crying on video. That means he's really caring, guys.
He's stealing Christmas from us.
I'm the man that needs to do
sorry.
it. You're welcome. I'm the man for the job. You don't have to like me. Boo-hoo.
Yeah. And you're all a bunch of idiots, so listen to me.
Yeah.
Yeah, and you don't have to believe in COVID because COVID believes in you. That's my favorite.
That sounds like a great. That's the slogan for the pandemic.
I can't believe I actually watch the press releases like every day because I'm in it, right? I'm watching, and just everything's on repeat. I feel like it's just the same things over and over. However, it's like, why aren't people listening?
Yeah.
Like, I just I get it, and it feels like it's just the media back and forth. Like, oh, they're making it about politics and not about the healthcare system.
Yeah.
Mm-hmm.
And I feel like that's what a lot of the issue is. It's like, it shouldn't be about politics right now. Sorry. Put the political agenda aside. You guys should all be coming together to collectively use your strengths as leaders to be like, how can we protect the people? But it just feels like everything's just still bickering and still arguing and still all these things. So I don't know. I guess I just see things differently in that sense.
No,
so.
You're not wrong. That's what we should be going for. But frankly, I don't know if it's unfair to say that this current government doesn't really like being critiqued or taking outside help or input. That's whatever. That's what it feels like, at least. That it's hard to come together when the ones in power aren't even willing to listen to the people below them.
Yeah, and I feel like that's the issue. Like, you can come at them with all the evidence in the world backing up your claims, but they're still going to say, nope.
Yeah, exactly. And do what
Get
they
your
want.
evidence out of here. Get researchers, they went to school for 8 years, get out of here. You know?
Scientists, no.
Oh.
No.
Yeah. What do epidemiologists know, eh? Nothing.
No, yeah. That's all. I just think it's like, I laugh about it because if I don't laugh about it, I'm gonna cry about it.
Yeah,
It's
I get
like
you.
something that it's like, I can't, it doesn't, there was no more of a helpless feeling than getting phone calls from all of those personal care homes saying how desperate they were. And I'm like, me and my little staff of like 5 people, I'm like, yeah, like we can't help everybody. And like,
Yeah.
I felt so helpless. And I reached out to literally every single person I've ever met who is a healthcare provider. And I was like, would you come and help with us? And they were like, nope, because of the media.
Yeah.
And how the media, you know, like, and I understand, but like, it's terrifying people to go to these facilities that aren't terrifying on the inside. So people aren't getting the care. So it's actually probably adding to the death toll because people aren't getting proper care and they're not, I can't say that for a fact.
Yeah. But it all seems to,
but I just, from what I see, that's all.
It makes sense.
And I can't see it being any different. Like, there needs to be more people.
Yeah.
You knew it was getting bad because I think, was it in Winnipeg where they saw one of the homes put out like a volunteer request form for people's families to come in to help? Like, you sign this waiver saying you know you're coming into a hot zone and please come help. Like, you know it's getting bad when you're reaching out to regular civilians to come help.
Yeah, and that's what I said too. And I said, you can't be asking for volunteers for this. You need to pay people. And then I said, I was like, what about all the people who are struggling right now to find jobs? Ask them right now.
Yep.
Hey, do you want to come and help feed people? We'll pay you. What was your wage before? Okay, let's match your wage and give you danger pay. Come on, you know, like, but no, it just doesn't seem like there's any action whatsoever on that. And then all they're doing is just relying on us as the private staffing companies to be the ones to find those people. So I just feel like they're pushing a lot of it onto us, and I understand. I mean, they probably have so many more things they need to on their plate that they're trying to see what they can offload. However, we're not. I honestly don't. I know as much as the public does, and I'm in it as a business owner and sending my staff in, and that's scary because I have to try to keep up on my own with everything that they're posting online and everything on the press, so that my staff are informed because they're not even informing us totally. So that's all. It's just been I guess from the aspect from our point of view, it's been very hectic and like, and then we get there's something now that we're starting to coin the term like COVID stigma, because we would go to these facilities that had COVID, and technically we're allowed to go and work at other places, but I would always reach out to the managers and say, hey, we were here, just letting you know, how do you feel about us coming to work at your facility? And they all say no. So we're stuck working at the facilities with outbreaks. And my team is great because my team is like, you know what, that's what we're here for. Let's do it. So I'm so grateful for them. However, if I had a team that had health issues or something, I couldn't send them to work now because just small things like that. Like, I don't know, just random little things that, I don't know, it's making it really hard for healthcare workers to go to work. That's all.
Right.
Sure.
And
Do
it's
you
just
guys...
like,
Go ahead, sorry.
No, go.
Do you guys get access to the rapid testing kits like the healthcare workers in the hospitals do?
Yeah, I've been just sending my staff saying, you go, and you are a healthcare worker. You go, and you say you are working at outbreak facilities. Here's my name tag, and that's it. And they haven't had an issue. I've only had, I've been tested because I got really sick once, and I had 2 other people who were tested, but we all came back negative because we wear proper protection, right? I think that's key, and that's what the government isn't giving us, is proper protection all around. But I just feel as though, we do have access to it, so that is great, and I'm really grateful for that, because when it was before I didn't have access to it. So I had to wait like the general public. So I'm off work wondering if for like a week almost, I had to wait for my test results. So for a whole week, I could have been back at work. So, and I really do think that the rapid testing is going to be a huge benefit to the healthcare staff, because now we're not waiting 3 to 4 days to find out, right? We're only waiting, 6 hours now is one of the rapid places that, that's like insane. So that's really great. And for the people who are at the high risk places like the ICU, who are the ones who are like doing all the intubation and like keeping them like alive, they're the ones who need to be there because they have the skills necessary to be there. And you can't learn those skills overnight. So they need to have those testings in place for those specific people with those qualifications to keep them safe, right? And to make sure that they're back at work as soon as possible.
For
sure.
Yeah.
As we'll move on a bit, but I think it's fair to say that most people are tired of the constant barrage of COVID news. It starts to become just white noise, and nobody listens to it anymore. And some numbers might change, and some of the restrictions might change, but overall, it's just a cloud of dread. So most people are starting to avoid it, which isn't helpful. But I think it's important to discuss kind of the mental health side of it. And when you first reached out to us, that was partly kind of one of the things. It was in response to our James Favel episode, which definitely touches on a lot of mental health and trauma and such. So COVID is definitely affecting people's mental health. But I don't know if you want to touch on your experiences with that, kind of how all that mixes together.
Yeah. So before, like when the whole pandemic started, it was like middle March, right? And they put restrictions in place so that we can only work specific places. So I had to start picking up shifts that were like random and that I don't normally pick up. Like, so I started picking up shifts that were suicide watches, and there were a lot of them that started popping up like as soon as the pandemic hit and everyone was in lockdown for that first time. The amount of people trying to access mental health services was like, it was nuts. And so there was actually a few people that I went to, and I would just be the person that they sit with and talk to. There was one person who was in the hospital for 5 days waiting for somebody who was a trained mental health professional to come and speak with her so that she can get released from the hospital from a suicide watch. So, you know what I mean? Like, so the mental health supports are not there. It takes a really long time for people to even access anything whatsoever. And as soon as the pandemic hit, that became very apparent, right? Because therapists and everything, you see those people face to face. So a lot of people weren't set up for the virtual care as they are now. And I feel as though I wish that there would be more people who can set up virtual care, and they can hire more therapists for right now, because it's not just like the general public that needs help like with mental health services. Like I'm seeing it in the staff. Like the government needs to take care of the people right now on the front lines. And I don't feel as though they're getting taken care of. They're getting burnt out. So instead of, when they could have probably just talked to a therapist and got some stuff out, instead they take like a whole week off from stress leave or something, just a lot of things like that. And there's a lot of people, a lot of the calls that I was going to were suicide attempts. And it like just made me really sad. And it just was really eye-opening, because it was like, wow, I didn't go to a lot of these before the pandemic hit. And then they were few and far between, right? Like they happen. There's always people for suicide watch. But I mean, for how many shifts that I personally got, it was kind of eye-opening, and really, it's actually really sad, because they told me a lot of like their problems were like financial, and they were going to end their life because they couldn't afford rent. Like, that's not something that's a long-term issue. That's a right now issue, and people are going to end their lives because of that. It was really eye-opening. And working through this whole pandemic, I've just experienced so many different things, and I've just seen so many things within the healthcare system that really need a change. And the pandemic just highlighted everything that was wrong within it. So I hope after everything's settled, that they start to look at these issues and be like, okay, well, it was an issue during the pandemic, so it must be an issue before. So how can we fix it? I just really wish that they can look at stuff like that, because I feel as though a lot of the people who are accessing the mental health services were Indigenous. So I think that's what upsets me the most, is because I'm Indigenous. I was born and raised in the north end of Winnipeg. I have overcome my fair share of barriers to get to where I am right now, to be able to employ people. And I just feel as though like there aren't enough supports in place for the youth right now, for what they're experiencing and what they're going through. And it just really shed light onto it. And I don't know, it just made me really sad, because a lot of the times I was going to the suicide were for Indigenous people. So
yeah, I mean, that's not a surprise, unfortunately, especially in this province, and that there's, in many cases, the simplest solution is money. You know, whether or not that's paying for rent or having enough money for food or childcare or medicine or anything. It's just we don't have enough access for people to get out of whatever they're in. Again, like you said, if you're on the verge of suicide because you can't pay your rent, that should be the easiest fucking thing to solve. Like there should be, the government just signs a check for $1,000. All right, your rent's covered for a month or two or wherever you're living. Yeah. And
now's the time to get that money out, because no one gives a shit about the budgets right now.
Nobody should.
Spend, get it all done now while you have a reason to spend, and then if you want to fight about it later, that's a different thing. But like right now, like you said, people are dying because they can't pay their rent, and it's sad.
Yeah. And that's like, people don't actually put, I feel as though these are just statistics, right? People don't actually put people behind these numbers. And suicide cases are just the same. I feel like they're just statistics. They don't look at like what that person was going through or how they were trying to provide for their family, and they just couldn't do it anymore. And, things like that, like, it makes me very sad. So,
and it's not, it's super common. And no matter what side of the political spectrum you're on, it's totally true to say that conservative governments typically, they cut costs, they cut taxes, they try to make smaller government because they see that as the issue, whereas, or then they try and battle things in a short-term way, like whether it's Indigenous issues or substance abuse or anything of that type of stuff. It's all very at the source or at the person, as opposed to trying to solve anything underneath, which involves or which requires a lot of money and a lot of supports and a lot of people. But to them, they want to solve it today instead of putting the money into it underneath, solving the problem, so that it might take a decade for any of this to work. But if you cut the funding today, that will never happen. It's just a function of conservative government. It's sort of how it works.
Yeah, and that's exactly what it is. And I was watching one of the press releases from the federal government, and they were saying, like, they were talking about how the trend was going to be up in December. So the provincial governments need to get their ducks in a row, right? And they literally said, don't worry about the cost.
Yeah.
We will cover it. And they said it on the press release. So it's like, why is Brian Palliser still cutting things like cancer care and cutting these things that people need? And like, he thinks that cutting these services is going to make our province better. However, cutting these services actually is going to make it worse. And we're actually seeing it make it worse. Like, people are struggling with poverty, and poverty is like the number one social determinant of health. So whether you can afford a place to live, whether you are safe, whether you can afford food, like clothing, we live in a harsh environment. We need to make sure that people have their basic needs met. And I feel as though the way that the government is spending right now or cutting things right now, is that people's basic needs aren't being met. Before I ran this company, I used to do safe rides. So I was a safe ride driver, because I used to just, all the women who were going missing, I wanted to make sure that they got home safe. So I would do that for volunteer money, and they would just pay me whatever they had, right? And I saved my money and put it towards my company. But like, as I was driving these people, and I started having regulars like I was a taxi, but it was like taxi cab confessions because people were telling me about how their struggles are and how she's like, I remember this one mom, she was saying how she's just really happy that she can put food on the table for her kids tonight. And I said, oh, that's really great. What are you having? She's like, minute rice. And I was like, just minute rice. That's a meal, but that's their meal, right? And that's not adequate enough to be able to give the proper nutrition to growing children. So they're not going to have the basic nutritions to grow into healthy adults. You know, like we need to start from the bottom. Like, I just don't understand. Like, researchers have come out and said how important childhood development is, and yet Brian Pallister is still cutting even education costs. So it's like, you're only going to make it worse, Brian Pallister. I'm sorry, but like, as somebody who grew up in the North End and who's lived there and that's my home. And I actually don't feel safe anywhere else, to be honest, because I get systemic racism from, like, I can honestly say this. I have white privilege in the terms of, like, I just got a phone call. I have white privilege in the term that I don't look full Indigenous. However, when people find out that I'm Indigenous, they say really horrific things. Or like, oh, well, you're one of the good ones, or you're one of this. And it's like, that's happening in the healthcare system too. And it's like, no, you don't say that. No. And like, so like, I'm seeing all these issues and like working in it, like systemic racism is so deeply embedded within our healthcare system that it bugs me sometimes to go to work. I used to have panic attacks sometimes to go to certain places because of how the staff treated Indigenous clients. And because I don't look Indigenous, they didn't know. So I would see how they treat them. And I'm like, it makes me sick. And then so like when the pandemic happened and we're all wearing masks, oh man, I saw it even more because Indigenous clients would come in with mental health issues and immediately they would be treated like so poorly because they're coming in a state of crisis, and they're like, nurses are already overworked. So they're like, I'm not dealing with this. And it's like, they're in a crisis. Yeah. I understand that, you know, you had a hard day and you don't want to get yelled at, but it's a very visible mental health crisis. So when you respond back to somebody trying to come to a hospital to get help and they get response back with like hostility, your nervous system is going to go through the roof right away, because you're going to be like, you're going to go in fight or flight mode because you're like, I'm here for help and you're going to treat me like this, you know, and like, and it escalates. And there's been times where I've sat back as a health grade, like literally watching two people argue, and it's escalating when it shouldn't have ever escalated to begin with, to that point. And I'm like, how did this even happen? And it just comes from people's unknown biases that they have deep within them, right?
Or known biases.
Well, some people actually don't, that same nurse who was yelling at that person, the next day she was talking about how she treats everybody so kindly and so fairly. And I'm like, no. Are you really?
Just, totally blind to it.
Some people actually don't know that it's deep within them. So I'm seeing that.
No, for sure. I think people of color in general have always had a distrust of healthcare systems and doctors and hospitals, because many times the typically white doctors and systems would, they would experiment on them or treat them like shit or not give them service at all or, do terrible things. So that's already a thing. So we need to move past that, because even the stories recently, there was two of them recently that got national coverage of Indigenous. There was a woman, and I think an Indigenous man had come into a hospital. I believe one was, I forget, Quebec. One was, I forget where they were.
Joyce Echewan, I think her last name is. I'm probably butchering her last name, but like Joyce. Joyce was the one from Quebec who was live streaming herself as the nurses were talking poorly about her. Yeah.
And so it's not uncommon, but again, it's one of those things that a lot of people like to sweep under the rug, or like you say, it's just an Indian or something, right? That's what a lot of people would say, and that's not okay. If someone comes into the hospital whether they're, the prime minister's son or, a kid on reserve or anybody, they should get the same level of treatment as far as I'm concerned. But that's not the case. But I hope that we continue improving. I don't know if we are improving, but I want us to improve.
Trying to improve for sure.
Yeah. Well, like don't get me wrong, like there are people who understand that these issues are there and they're very conscious about how they treat people, and you can tell. But there are other people who just don't believe that it's actually a thing, because they're so oblivious to the fact that they have all these underlying biases within them, right? So like they don't see it the same way.
Yeah.
And that's all. It's just I really just think that it just comes from I don't know if it's not going to be addressed overnight, obviously. No. It's going to be something that's going to take years and years, maybe even decades, to get out of like our train of thought, right? So if you, like with our brains, like I don't know if you know about like neuroplasticity, if you keep doing something over and over, you're going to get good at it, right? So if you keep believing something over and over, well, you're going to have that belief in you, right? So like you have to purposely and actively retrain your brain to get out of those belief thoughts and those cycles that you're in with like habits and everything. So like you can actually do it. Like when people say, oh, you can't teach a dog or an old dog new tricks, I'm like, yeah, you can.
It might take a little bit longer.
you just it takes a little longer. Yeah, exactly.
Yeah. No, but, I think that's true. I think it's also important. It blends over really well with Pallister's recent comments about vaccines, and the federal government was going to allot a certain amount to Indigenous communities because, frankly, they've been hard hit. It's a fact. And then he's talking about how it's not fair to non-Indigenous Manitobans, blah, 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 as though he made it pretty clear he seems to think that they're distinctly different Manitobans from the people on reserve and not. And I don't I don't know all the specifics, so I'm probably, throwing stones when I shouldn't, but frankly, why not send them where they're most needed, whether or not it's Indigenous or not, and if they happen to need them, then they need them. It makes no difference to me.
Yeah.
Yeah, and honestly, like that whole comment, I remember watching it, I was like, oh, that's going to cause issues, like, and it blew up in the news. And it's because I guess the general public doesn't understand that, like, technically reserves are funded through the federal government, right? So, but at the same time, they're still Manitoba citizens. They still live in Manitoba. And the reason why Indigenous communities have to get those vaccines first is because they don't have access to healthcare the way that we have access to healthcare in Winnipeg here. Like they have to get, some of those communities are fly out communities. Like you can only get there via plane. So if someone gets sick, it's so much easier for us just to ship a box of vaccines there versus to have the whole community have an outbreak like what's happening in Shimatawal right now, where, there's 1,000 people in that community and 100 and something people, I don't know the exact numbers, but are affected. That's 10% of their population. That's massive. And people aren't actually understanding that, like, there's a reason why Indigenous populations have all these health ailments such as diabetes and stuff like that, is because we don't have the same access to basics the way the rest of the Canadian population does, honestly. And I've seen it firsthand, like even like being younger, like going shopping with my mom and having people following us around the store, and like to the point where my mom was just like, I'm not shopping here again. So then we would just shop at the corner store where we didn't get racism, but we also didn't get proper food because of it. So because my mom was trying to avoid racism, or like, we went to the corner store instead of big grocery stores like it's so deeply there. Like I said, it's something that you have to, it's like an onion. You're going to have to just pull apart every layer and address every layer as to why it's like that, but everyone's just grouping everything together, but it's actually systemic from a bunch of different things. So like education, from the justice system, from the healthcare system, so
Everybody
It's not
wants the
just the
quick
healthcare
fix.
system.
Yeah,
It's
everybody wants
Canada's
it just
dirty little secret that nobody likes to talk about.
Yeah.
Yeah, and
It's not even a good kept secret.
Mhm.
no, and it's not. And it's like the UN, I think, released somebody did like a report or a deep investigation about like the reports on the missing and murdered Indigenous women and girls. And they were saying, yeah, it's a genocide. And the government's just like, oh, what?
Oh, no.
Put that under the rug. Come on. Like,
Yeah.
I don't know. Like, I just, like, being an Indigenous person who grew up in it and as seeing my family struggle in ways that normal population doesn't have to struggle, like, it was normalized to me growing up, like how different and things were and poverty is, but it was normalized then. So like, I guess seeing it now on the outside as like a fly in the wall and like hearing everybody else's stories, I'm like, no, this isn't normal.
Yeah.
This isn't normal way of life. This is a way of life that has been filled with trauma from the past generations. So like, you know, like we need to address the issues deep down rather than just trying to mask them with antidepressants and anti-anxiety meds, because that's how I feel our healthcare system is trying to deal with the issue. It's not dealing with it. So.
No, you're dealing with the symptoms, not the cause.
Yeah.
And speaking of trauma, you had shared it. I saw Wob shared it. I'm going to read it here. Trauma in person, decontextualized over time, looks like personality. Trauma in a family, decontextualized over time, looks like family traits. Trauma in a people, decontextualized over time, looks like a culture. Resma Menakim, I'm not sure if I pronounced that right, but it's totally true, right? It's easy to just see it as though that somehow represents everything that this person or peoples or place is known for, because that's all they know. And even then, the people there, that's all they've known as well. So it's, how do you expose that, right? Like I've heard a lot of Indigenous kids that they sort of make the jokes that white kids make, but as though it's funny without actually acknowledging that it's not, you know, if that makes any sense.
Yeah.
So it's hard to hear.
Yeah. No, I totally, that's exactly it. And I was actually talking to a friend of mine about this. She's incredibly intelligent. She has 3 degrees. She's a teacher. She's incredible. And we were talking about this and saying how, the Indigenous population, like if you ever have like Indigenous friends, like we're always cracking jokes and we're making light of everything. And I like really sat down and thought about it. And I was like, the funniest people that I know have experienced the harshest stuff in their life. And you just think about it, it's like, you know, and then that's why I shared that, because that's exactly what it is. Because like, I think about my family and like how we're all so similar and how, you know, like, oh, that's the Peebles family, or that's the Weeb family, or that's the whatever family. It's not just the fact that like trauma happens in every family regardless, right? However, it is so much more in Indigenous populations because that trauma from residential schools and the 60s scoop is still lingering, right?
Mm-hmm.
And people think that it was very long ago. However, it wasn't, because like my mother was a part of the 60s scoop and she was raised in foster homes that were not good for her and and she was the protector of all of her siblings. So I mean, like, how that affected her as a child, not getting the emotional support that she needed, affected my childhood. And it wasn't until literally this year I was like, oh my gosh, I'm right in it too. Like, that's why I'm the way that I am. And I started to unravel things. And it was like, oh, I'm like this because that happened to me. Oh my gosh. And then so like, you know, when you start to like really unwrap it, it's like both eye-opening and incredibly sad at the same time, because you see these traits in so many of the people that I love. And I'm like, yeah. And I know their stories. I know what happened to them. And it's some of the most horrific things that I've ever heard has happened to some of my family members and friends, because we live in the North End. And the way, I guess the communities view it around, it's like, oh, don't go to the North End. Don't go to the North End. Yeah. But like, I get it. However, like I said, I've never had an issue walking around the North End ever. I've never had an issue. There's a sense of community. People smile at each other. But when I go to like South End or something, I lived in a different area and I hated it there because I would walk around and people would be snarling at me, and it's like, wow, I don't belong here. And then so like as an Indigenous person, you grew up in the North End, so you're going out and you're trying to explore the world, trying to be like, I'm going to achieve my dreams. And and then you go out there and then people are treating you that way. And you're like, oh, what the fuck?
Yeah.
Pardon my language.
Yeah.
But it's like, you wonder, what's wrong with me?
Yeah.
Why are all of these people looking at me that way? What did I do? You know, and then you start to conceptualize something's wrong with you and that you're bad and that you're the problem, because that's how it works when you're a kid, right? You don't have a lot of guidance. So that's what I want to just stand up for Indigenous youth out there. Like, there are people who are gonna, you know, shit all over you for trying to pursue your dreams, but it has nothing to do with you. It has everything to do with them and the fact that they weren't able to do it, and they see somebody who they were told shouldn't be achieving anything, and they see them achieving something. It like makes them feel something on the inside, and they just have to attack you.
Yeah.
So that's what it's like.
Yeah.
And even just trying to build this company, the reason why I stopped and I changed my direction of how I'm going to build it is because of it's a man's world out there when you're a business owner. And if you're a younger female Indigenous business owner, I've experienced so much racism from accounting firms, from business advisors, from like these men telling me that I'll never achieve anything. So like I ended up just stopping, not trying anymore. And that's what the issue is. Other people telling you you can't do it. And eventually you say, well, this is just who I am.
Yeah, I guess I can't.
And that's, and that's the issue. And that's why that post resonated so much with me, is because like when I was in high school, I made a joke in the library and I made everybody laugh. And my high school principal pulled me aside and he was like, pulled me into the library, the back room, and he stood in front of the door and he like slammed the door and he was like, what are you doing? And I was like, what are you talking about? And he's like, why are you laughing? You guys are being so loud. And I was like, well, I just made a funny joke, right? And so we're just laughing about it. Sorry, we're working on a project. And then we were the only ones in the library, and he like gave me shit. And then he was like, I don't even know why you try so hard. You're just going to end up like a bum on Main Street like the rest of them. Oh. And like that was my vice principal. And it's like, wow. And then I started to skip a lot after that. Yeah. And so I was a really good student too. So like I was trying really hard to get like all the awards so that I can put myself through university. And yeah, no, it's a whole systemic thing. It's not just the healthcare system. It's literally everywhere. And we all need to have these stories heard so that we can be like, oh, that's actually a person who had something happen to them, but they overcame it. And that's why I guess I just wanted to like bring it forward and be like, it hurts a lot. And you may feel so, like your life doesn't matter or anything, but you'll get through it. And it's just that temporary, that little time, and you'll eventually get over it. So it all ties back to the whole mental health thing with the suicide watch, right? So I don't know. It's all tied together. I think. So thank you for letting me talk about that. Not a lot of people see it from that point of view, and they don't hear the stories. So I just hear it from not only volunteering, but like, I just hear it from not only volunteering, but also from, just working with my company. So it just, it's for sure. It's so normalized to me that it's like when I see it being talked on the news, it's like, oh yeah, sell some more news, but they're not actually dealing with the issues. It just seems like everyone's just arguing back and forth rather than working collectively. That's all. Yeah, and we're sure. We're both white. We have privileges that we didn't know that we had and that we currently still have. Like, for instance, a friend of ours has been on the show before. She's Indigenous, married to a white guy, and she said she goes into a store by herself and she gets followed around, or subtly. Everybody's sort of like, oh, can I help you? Or, they're always keeping an eye on her. But when she goes with her husband, it's fine. It's like, oh, you have your white guardian there. You must be on the good side or whatever. And it's that type of shit that
I hate. And frankly, we're in a community where that's not uncommon. But I think it's important, as we say, to spend our privilege cards, as Randy and I have, to try and get these messages out, because it's so pervasive, and so many people, for some reason, don't believe that systematic and systemic racism is a thing, or that white privilege is a thing. And I'm like, are you alive? Like, do you walk around? How can you say that? But that's why I like getting stories like that out. I mean, it's as harsh as it is, or as traumatic as it's been. Props to you and your family and everybody for acknowledging it. And we got to try and how do we move forward if we don't move, right? it's hard.
Yeah, exactly. Like, there was a saying where it's like, I can't remember. It's something about if you're on fire, run, or something like that. Don't just stay still, right? So like right now we're on fire. We shouldn't be staying still. We need to be pushing forward with this movement, and we need to continue to, like before the whole like COVID happened, like there was a lot of like fighting for Indigenous rights, and that was a lot of the stuff that was in the news, right? And then COVID hit. So like that stuff's still going on. People are still fighting for their rights. However, it's not covered in the media anymore because it's all COVID, right? And I feel as though unfortunately, that's what I actually notice in care homes is people tend to get their news from the same source. So if you're only getting your news from the same source all the time, then you're not fully informed as to what's going on, right? So that's actually something that I learned working with the older population is they had their dedicated news channel and they only listened to that one anchor that they love.
Right.
But it's like, and I remember one time I said, I was like, yeah, but what if he tells you something wrong? Are you just going to believe him? We were like having an honest discussion about it before. And she was like, what do you mean? She just didn't understand that media could sell like misinformation. So I was just like, oh yeah, okay. Well, he has a nice tie. She would say like, he's so handsome. That's why I watch him.
Oh, yeah.
And I'm like, oh yes. That's how they get you.
That's why we're on the radio, or do we do podcasts? Because we have faces for radio, so we're going to avoid the actual news because none of the old ladies are going to be heart-throbbing over me and Randy. So
that's why I chose podcasts too. Like if I were to ever do something, I would do a podcast too because I got a face for radio too.
No, it's fine.
So funny.
But you should start a podcast. So we're going to be like Joe Rogan and just tell everybody to start a podcast and get the stories out, the
more people talk about it, the better it's going to get for everybody.
Yep.
Yeah, I actually was thinking about that. I was thinking about starting a podcast to bring about some of the stories that I've heard. And yeah, it's just, hearing some of the stories and hearing what some of these people have been through, it's like, well, no wonder why you turn to substances, because I wouldn't be able to handle that. Yeah. And they don't have the supports, like some horrific stuff happened to them. And okay, wait, I just want to say one thing here. One person that I did meet when I was working at one of the hospitals, he was a volunteer firefighter and arrived at the scene at the Humboldt bus crash.
Oh, wow. Okay.
Yeah. So I ran into him and I was working with him and he was so upset. And then I asked him, he kept calling for the nurses and the nurses were like, just let him. And then so I sat there with him and I said, like, why do you want to meet the nurses all the time? Like, why do you keep calling for the nurses? And all he wanted was just to talk. So I listened to him for I think it was about a half an hour. And he talked about how horrific it was and how he couldn't get the screams out of his head from the bus crash. And I was like, he went there as a volunteer firefighter to help save these people, and mental health supports aren't in place for our first responders. And I also asked one of the paramedics that I was doing an appointment shift with. So if they don't have the proper machines to do scans for like cancer or whatever you're dealing with, they'll send you to Winnipeg, right? So I was in the ambulance with the paramedic and we were talking. And then I asked him, I was like, you must see a lot of really crazy things as a paramedic, right? And he's like, yeah, I do. And I asked him, I was like, what are the supports put in place for paramedics and first responders in terms to mental health? And he said that there are none. So I think that that's an issue because if you're seeing horrific things all the time, it doesn't matter if you're a first responder to the scene or if you're experiencing it, it's still traumatic. And those traumas will still stay within you regardless of what your skin color is.
Yep.
So I feel as though just like there needs to just be more support in terms of mental health, especially for right now. And with with COVID, it's showing like I can see you on my phone right now, you know, like you can create safe places for people to seek therapy, you know, in a more accessible way. Like it's like this whole situation has shown us that we can actually really change the way our whole systems are, because I remember I brought forward, I said, why can't we have more video lectures? It would be so much easier if I can study from home and not have to like bus an hour and a half to the U of M to go to school. Yeah. And they said it's not possible. So like this, you know, like, and then back in the day, so like when I was in the U of M, and then it's like, so now it's like, it's totally possible. Like, could you imagine now we can implement technology into education and we can access, we can get people educated who may not have had those resources to be educated now with technology. So, I mean, we should be using this time to like reframe how we're going to move forward in life, because we're obviously seeing that there's issues now. So how are we going to move forward and change it for the future?
Well, everything's going to be thrown on its head and shifted, and whether it's work and jobs and healthcare and everything, people are realizing we can do things differently. And I hope that that's for the good. So anyway, we should start dialing it down here. Let's see. Do you have anything you want to, other than obviously we touched on shout outs to your staff and your coworkers? Is there any websites, social media, any other accounts you want to plug?
Maybe I'll just I'll just plug my business website. It's not up as of right now, but it will be like tonight or tomorrow. Perfect. But
this will come out in a week or so.
Oh, perfect then. So the website address is cherishhealthservices.ca.
Perfect.
And there will actually be a link. So if you are interested in somebody, like if you want to come and help out at the care homes, and you're interested in coming to help feed people and help the staff like us with our regular duties, feel free to send me a resume, and like I can help you get involved to help, you know, protect people. So there's also that too. If you're struggling financially right now, just talk to me. I'll see if I can get you involved somehow so we can help that way. I just want to say thank you guys for all that you do. Like, bringing awareness to a lot of issues that, you know, people don't normally think about. And just having that discussion is enough to be like, get the hamster wheel rolling for some people, you know?
I hope so.
I really appreciate all that you guys do too.
Oh, it's nothing. It's nothing. No, we're pretty low on the totem pole as far as important things go, but I'm glad that we can try and move, especially since when we started this whole thing, it was just me and Randy in his basement shooting the shit.
We're just being goofs, basically.
Yeah, and my neurotic head has things bouncing around in it a lot, so that's sort of that's just me vomiting it out into the world. So I'm glad that it's made some impact.
Well, it definitely does. And honestly, creativity is how you stay young in the mind. So keep being creative. Yeah. And keep shedding light on everything. So I really appreciate it.
Thank you for joining us, Jess. It was great. I hope you guys stay safe. Keep working hard, doing what you can.
Yeah, thank you for all the work you do. Absolutely, for keeping people safe and healthy and, helping.
Yeah,
for sure.
Thank you. I thank my staff more. They're out there more than I am. I'm stuck doing a lot of the paperwork, so I get out there when I can, but it's mostly them. So
perfect.
They're the all-stars. And everyone else who's working on the front lines right now, honestly, you guys are heroes, and you all deserve a 5-month vacation after this is over.
No kidding.
Empty hospitals. Nobody's
yeah, we're all done.
Sick.
We're all healthy now. Yeah, just put them out to pasture.
Yeah.
Okay, but thanks again, Jess. This was great.
Okay, thanks.
Hopefully, stay safe.
Take care.
See you.
Bye.
Okay.
All right.
It's the two idiots. Right there.
Right there.
Right there. Yeah, okay, so thank you for listening, folks. You should definitely check out that website, Cherish Health Services.
cherishhealthservices.ca.
Yeah. They're doing some good work out there, and they could use some support as well, especially with our personal care home issues. So, yeah, okay, so find us on social media, on Instagram at Two Idiots Podcast, on Facebook, search for the Two Idiots Podcast, on Twitter, we're Two Idiots Show, and on YouTube, search for Two Idiots Podcast, and look for our logo. We're hard to miss.
And by email, doubledeedspodcast@gmail.com. Send us anyone you think might be a guest, any comments, questions, anything you'd like to send it to us. We'll read it. And you can also go to patreon.com/2idiotspodcast and sign up there if you'd like to help support the show. We start from as little as $3 a month.
Absolutely. And patrons at the $7 tier or higher, so, if you're really cool, if you really like us, they get a shout out every episode. The Two Idiots Hall of Fame. If, as you...
Very prestigious.
If you were. Yeah. That's what I was trying to say.
As you were? If you were?
If you were. I don't know. It's fitting that I can't speak for the Idiots Hall of Fame. But, so you basically get your name shouted out. How do I
Real
shout
Canadian,
it out?
eh? You're going to get a shoot out on the podcast.
Shoot. I'm going to get your name shooted. How about that, eh? So huge thank you. It helps supports the show, makes us feel really good about ourselves. So thank you to these people. Randy, do you know who they are?
We have Danny Dewick, Kayla Lundberg, on behalf of her and Jordan Peters, Drew McDonald, and Mr. Brian Moore.
Woo! That's the Idiot Hall of Fame. They're wonderful people. They think we're okay too, I think.
You would think so. I mean, they're throwing us some shekels here, so not for nothing.
Not for nothing. So
we appreciate every penny of it, and we appreciate your patronage to our show.
Indeed, your patronage.
Patronage, yes.
So, welcome to the Idiot Hall of Fame. Thank you so much, folks. It helps us keep doing what we're doing.
We appreciate it. We really do.
Much love.
And, just help us make the show a little better for you.
Indeed. So, folks, thank you for listening. I hope this was another one that gave you a little bit of perspective, maybe a little bit of insight into the situations going on with our elderly and people in care homes.
For sure.
And just be kind to each other. Be nice. Everybody, let's
we're all
just
humans.
stick together.
Let's, we're all, it's cheesy to say we are all in this together and we all got to kind of we have to work to help everybody, not just ourselves.
Indeed. Speaking of that, please subscribe, rate, follow, review, just tell a friend, spread the word. Let's try and get this little idiot boat floating higher. I don't know. That metaphor fell apart. But let's...
We just want to get into everybody's ear holes.
Yeah, deeply.
Put it that way. Yeah. Real deep in the holes.
A full-on thrust. Sorry. Anyway, let's shut this shit down. All right, folks. We love you. Keep fit. Have fun. Thank you for listening.
Stay safe out there.